Okay, my name is Jorge. I'm a consultant psychiatrist, editor of Global Psychiatry Archives, and we present some of the thoughts which have been presented in papers. So this is a paper from the section of Suicidology and Suicide Prevention of the European Psychiatric Association, and it's led by Marco Sarchiapone, who is also editor of the journal. And so what they came up with is that, they looked at the different the knowledge which was available in 2020 and made people aware about the need to look at different issues. So there was, or there is, a risk of more mental health problems in patients with COVID during the pandemic, which is possibly due to the restriction which were adopted worldwide to contain its spread. There were anxiety, fears, depression due to unsafety about what's going to happen and the infectiousness of the disease. They also focus on very specific samples, such as prisoners, LGBT+, Q+ community, migrants, and ethnic minorities. And the conclusion of this paper is more or less that these issues should be carefully assessed. And, we have published some papers, and Professor Wasserman has given a talk in our recent conference in 2020, October 2020. And the conclusion of this paper is more or less, and I come to that here, that, all these risks should be assessed, and that, these unprecedented times of COVID pandemic need whatever evidence and support which is available and needed, and mental health promotion and suicide prevention intervention should be taken very seriously and be pivotal for migration of the socioeconomic and psychological mitigation of the socioeconomic and psychological consequences of the pandemic. There's a need to develop cost-effective interventions, help with resilience of the people, and the other thing is take this pandemic to learn for future problems to come. So I think this call has been heard. This paper has been seen and read by about 3,000 people and downloaded nearly 1,000 times. And I think, yes, things have been progressed since then. And I think there is anxiety and depression, which has been documented in many samples and problems. And there has also been some resilience. And I think this pandemic is something where the whole world has to learn from. And thanks for listening. If you want to see the whole paper, please look at www.globalpsychiatry.co.uk. And if you want to hear more of these paper explanations, please consider subscribing to our channel. Thanks for your interest.